Okay, we're back from the break, rather short break, but during that commercial break, we did manage to talk to Ray on the phone, and he basically had a question about penicillin allergy, and he said he was told he was allergic to penicillin, and there is some question that over time, does the allergy go away, and would he be able to take penicillin again? So I don't know what the nature of the initial allergic reaction was. And a lot of people will describe allergic reactions like to morphine and codeine as nausea and vomiting. Well, that's a natural reaction to the antibiotic. That's not an allergy. If you had hives, such as whelps on your skin and itching and had any difficulty breathing, that's a really severe allergic reaction. And yes, over time, the memory to that allergic reaction will dissipate, and the second challenge with that particular product may not be as severe as the first time, especially the older we get. However, the body does remember, and so that could come back in a vengeance, and so you're better left not experimenting with that situation if you can avoid to. So again, if you had a severe allergic reaction with difficulty breathing, closing of the throat, I suggest you never go back to that product because the second challenge or third challenge could be deadly. If it did wax over time and you got re-exposed, then could you re-challenge yourself? I'd look for a better alternative and use it as a last resort. Within that penicillin allergy model, sometimes we use Keflex and cephalosporins, which are derivatives of the penicillin molecule, and about 1 in 100 patients that are allergic to penicillin may have some allergies to cephalosporins. It's usually not as severe, but again, we always have to be aware if you have a penicillin allergy. Plenty of good antibiotics out there to look at as an alternative to penicillin. And of course, some of the reason there are no new antibiotics coming down the market is because pharmaceutical companies have figured out that where they put their R&D and research into is to drugs that you'll take for a lifetime, such as diabetes or high blood pressure or heart disease medications. And you see plenty of those coming down the pipe because they can get any return on their investment. Okay, let's bring up that slide because I wanted to again highlight some of the things that you might look at again. I call it homeopathics. Basically, it's over-the-counter remedies. I've been able to get all these on Amazon.com. Great place if you don't find them in the health food store. Not to take any business away from a local person, but certainly you could try some of the local stores. Again, black elderberry, sambucol, very good for colds, symptoms, runny nose, sore throats. Colloidal silver, they sell it. I've got it on Amazon. You may find it at health food stores. Again, I don't think the ionic silver is very good. I'm not sure about that. I know colloidal means it's actually in suspension, not more than 500 parts per million per day. Activated charcoal, 1 capsule, usually 250 milligrams. Be careful to take activated charcoal. If you take it with something else, it's going to absorb that product and render it inactive. So you might want to take the activated charcoal at a different time than taking the other products. Ginger root, Golden Seal, common, one of the brand names that makes it. I wouldn't use more than 2 per day. It's very medicinal. Propolis, which is bee pollen, 1 a day, and of course echinacea, 2 caps per day to help find that. Zinc, zinc lozenges, airborne, that may be useful initially. But these are immune boosters. If you want to write those down, we'll leave the slide up for just another minute so that you might get some information. You can research it, do whatever you want to do. But I think during cold and flu season, these are your natural antibiotics. And again, certainly, you know, as we've seen, you can go get a flu vaccine, but that flu vaccine, there's a different strain of flu that comes out. And then you went to the trouble to get that vaccine, took a risk for an allergic reaction, an adverse reaction, and then you find out it's not as effective. So apparently, this combination has been very effective for a group of homeopathics down in Texas, and their claim is that once they start on this regimen, they have never gotten any of the H1N1, any of the other flus, and you know that colloidal silver may have a little bit to do with that in combination with some of the other symptoms in there. So anyway, good hand washing, good protection of your face, those are all very important, and those particular products. Okay, so if you need for me to bring that slide up again, I have it and we'll bring it up there, or you can call in. Let's talk a little bit about one of the things that I had a conversation with one of the pharmacists today, this weekend, and one of the things I told you I've had a rant about this for a while. What I got the gist of was that their corporate office was going to look at what they call a scope of practice, meaning here is someone in the corporate model deciding whether or not a physician is within his scope of practice to prescribe opioids for a patient. This is incredibly dangerous. I can't imagine a situation where someone in the corporate office at pharmacist is going to question a physician's scope of practice. If you have a valid DEA license, and he's told me to be careful, and I told him he'd better be careful, because if they started messing with that, I suspected that there would be a huge semi-revolt against the pharmacies that were going to start enacting this particular type of policy. And I'm very disturbed that pharmacists and physicians are being pitted once against the other. The phone call was prompted because someone I knew went to a pharmacy to get a pain medication filled, and they would not fill it because they were not a regular customer with that particular pharmacy. And this is all part of this. I don't even know where it's all stemming from. Well, obviously it's stemming from the pill mill bust in Florida, and I don't know the exact date, where Walgreens decided that they were going to just cut off the amount of opioids they were shipping to pharmacies because the pharmacists weren't doing their due diligence. So you see what this is doing, meaning the pharmacy doesn't do its job to question a large opioid prescription, and that's appropriate, meaning if someone walks into the DEA will say, oh, there's no limit on the amount of opioids that you can fill. Okay, great, I understand that. I mean, that makes sense. Why would they want to limit that? There is no limit. There's no ceiling on opioid prescriptions. Some people build up tolerances. They have chronic pain. But then the pharmacists come in and they set the limits. Well, okay, so the government says no limits, but the pharmacist sets the limits. Well, they should be asking questions. If certainly, if someone's walking in and the pharmacist has a suspicion for whatever reason that is, that's fine. Call the physician. Find out what's going on. If you're blindly filling a large number of prescriptions on multiple patients and not asking any questions, you're the one that's breaking the code of ethics here, not the physician, not asking the physician, why are you writing 500 oxy-IR30s? I mean, don't you think that a light bulb should go off in doing that? And then so far, what Walgreens does is it basically punishes everybody else by limiting that. And that sets off a chain reaction through all the pharmacies, meaning if Mrs. Smith couldn't get her hydrocodone at Walgreens, she has to go to Smith's. If Smith says, I'm not going to take care of you because you're a new customer and you haven't filled it here before, then they have to go to CVS. And CVS gets inundated with a large number of opioid prescriptions. And then Walmart gets inundated with a large number of opioid prescriptions. And there's this so-called rule that distributors are now placing a 30% moratorium for different pharmacists. I've never even heard of this. And if they're doing it, who's telling them to do that? This is just out of hand. And so as a consumer and if you're watching this show, you should be very, very worried about what is happening behind the scenes. When you go to a pharmacy and tell you, oh, there's a shortage, or oh, we're out, or oh, we can't get it, or you'll have to come back next week. Really? Why? You know what you're filling. You're placing strains on patients, meaning you're prejudicing your thoughts about what a patient should or should not be taking by either limiting quantities or not wanting to fill a prescription because they so-called don't meet your profile. Wait a minute. you're not the DEA. The pharmacists are not the DEA. I'm not the DEA. The DEA doesn't even want to talk to anybody in this town unless you have a Spanish surname, Mexican surname, where there's 2,500 pills involved. And I've heard that directly from the Street Crimes Division. So this thing is getting way, way, way out of hand. It's still time for you to complain to your pharmacist, confront your pharmacist. Why are you lying to me? Why are you not telling me the truth? Why are you not ordering these prescriptions? Why would you not want to fill them? I have a licensed physician who wants to fill them, and I need them, and you're making me suffer because of that. This, I mean, the more you complain, the louder you complain, hopefully this will stop. Complain to your congressman. Complain to your senator. It's very important that they hear from you. Remember, their job is dependent on that. And trust me, in a day, I may write a lot more as far as pain medications than I ever write in antibiotics. So there's a lot more people, especially in this town, on pain medication than there are that are taking antibiotics. And because we have to see them so frequently, because we have to do so many different things. I don't know where this all goes and where it all spins out, but I mean, I'll use this time on this show to rant and rave so that patients, you know, can complain to their pharmacist, can look for the things. I believe, and I don't mean to promote one pharmacy over another, but prescription drug abuse is a problem today. It's always been a problem, and it always will be a problem. And we and the pharmacists do our best job to try and prevent that from being a case. But fortunate that the good people in this town, the non-drug abusers, are half the few bad people. Things about, and I'm not a politician, but it's one of the things I do not like about that all the time. We are being penalized for the few bad apples out there, and they want to make these rules for these few people, and we all have to suffer as a result of it. So. Didn't have time to talk about hypertension, but I'll maybe put together some few slides on that, and we'll probably bring that up next week, and I'll certainly let you know if I hear any more information about this opioid scandal. And I call it a scandal because, again, it all started with Walgreens after they weren't paying attention to what they were doing, and the customer now has to suffer. So. That being said, pick and choose your pharmacy based on customer service and how well they're going to take care of you, the patient, and the customer. Remember, you vote with your pocketbook. So if your pharmacist isn't treating you fair and they're not talking to you and they're not taking care of you, then it might be time to vote your money somewhere else, okay? And remember that, very, very true. You don't have to take it if you don't want to, unless, of course, that's where you have to go to get your prescriptions filled, and that's another topic for another show. So anyway, thanks for hearing me out. I know I get very passionate about this issue, but I believe I am independent. I believe in the little guy, and I don't believe that we should be pushed around by some corporate dogma somewhere else. So thank you very much for tuning in, Pahrump. As always, I enjoy doing the show. Stay healthy, stay dry. See you next week.